So I and Flinders NT acknowledges and pays respect to the past, present and future traditional custodians and elders of this nation and the continuation of cultural, spiritual and educational practices of Aboriginal and Torres Strait Islander peoples. In particular, the peoples of Larrakia country, from which Lisa, Sarah and I are sitting in Darwin, and the Turrbal people where Sandra is zooming in from Melbourne, and other lands that our attendees might be joining in from. My name is Josephine Chia. I am one of the general practitioners working in Darwin. I also happen to be a Darwin girl and have also worked with the NTMP here in Flinders. I now work for Flinders as a clinical educator in the third year program. I'm proud to be facilitating this series of Medical Career Pathways webinars as a collaboration with Flinders NT Regional Training Hub, specialty colleges and respected NT clinicians. Usually you would have Dr. Olivia O'Donoghue, but I am stepping in today, so I'm sorry about that. Today we are joined by the Australian College of Rural and Remote Medicine, also known as ACRRRM, to talk all about the exciting and hands-on career opportunities they offer, in particular the general practice training pathways available in the NT to create dynamic, highly skilled and sustainable workforce for Territorians. So tonight we have Ms. Sandra Johansson. She is the ACRRRM training manager and she's located in Melbourne. We have Dr. Sarah Goddard, who is a fellow of ACRRRM, and Dr. Lisa Waters, who is an ACRRRM trainee. Both of them are in the Territory. We will get Sandra to speak first.
Thank you very much, Josephine. And just to let you know, I was supposed to be presenting from Melbourne today, but I'm back in Brisbane.
Right, sorry.
I did mention that, but yes, I'm back in Brisbane now, so I'm presenting from Brisbane this evening. So welcome everyone. As Josephine said, I'm the training manager. So I'm just going to take you through the training program, the fellowship program, and the application process and tell you a little bit more about the college, but I'm sure Sarah and Lisa will add all the exciting pieces. Mine's just the logistics piece, but it's going to give you a good framework of to what it's actually like to be in fellowship training and what ACRRRM training is actually all about. I will share my screen with you so you can see. I'll just check with Josephine that that's good. You can actually see that my screen. Wonderful. Okay, so like I say, welcome. It's ACRRRM, the Australian College of Rural and Remote Medicine, and our focus is very much around rural generalism, general practice being the specialty. But our focus is definitely on rural primary care and rural generalist practice. So we are dedicated to that as a college, and we practice nationally and work in each of the states with wonderful people like Dr. Sarah Goddard and Dr. Lisa Waters in the Northern Territory. So I'll tell you a little bit about our fellowship program and kind of where to start. So our training is a minimum of a 4-year full-time training program, and it comprises of core generalist training and advanced specialised training. And what that actually means for our trainees is that you are getting a broad scope of practice across primary care, secondary care, emergency care, and with the specialisation involved in that. And again, like I said, it's very much the focus is on rural and remote practice. So all of our training occurs in regional, rural and remote settings. So in MM 2 to 7, you may not know what that is, but you would soon get to learn that it's not it's not metropolitan training, okay? And you would gain your experience in a range of different services. So in hospital and in primary care settings, and Aboriginal health services, and also with specialised services as well. So you can see that it's 3 years of core generalist and up to 24 months if you're going to think about surgery for your advanced specialist training. And it actually consists of a programmatic work-based assessment and also some standardised assessments to achieve fellowship. So the core generalist training, to break it down a little bit more, is around paediatrics, anaesthetics and obstetrics, which are the main rotations that we ask our junior doctors to actually focus on. So when you're in the hospital, those are good foundational rotations to get to actually set you up for ACRRM training. Across primary care, emergency care and secondary care when you're in your core generalist, and as I said before, rural and remote practice. The education programme is structured. It's a structured education programme either delivered by the college or with the regional training organisations. So in the Northern Territory, that's NTGPE. You may have heard of them, and we work closely with them to support registrars on their programme. There is also the assessments, which everybody's always interested in because that's what the end goal is. And that means the core generalist logbook. And you can actually start doing your core generalist logbook very early on in your training. You can start to do that procedural logs right from being an intern, PGY1, PGY2, sorry, and yeah, you can start to do that straight away. So I'd encourage you, if you're interested, is to have a look at that logbook and see the types of procedures that we look for. We do mini CXs, which is mini clinical exercises. So that's observations in work-based, case-based discussions. That's a work-based assessment as well. Multi-source feedback, that again is a work-based discussion, and that's around 360-degree feedback from patients and also colleagues. MCQ, which is a multi-choice questionnaire, and our structured assessment using multiple patient scenarios. That's our STAMPS exam, so that's our big structured exam that we do. The advanced specialised training, so this is where I'm saying that it's two components, core generalist and advanced specialised training, and these are all of the disciplines that you can look at for areas of interest. And we very much focus around a community needs. So looking at what the community needs and what the community health needs are for you to be able to focus your discipline and actually get your experience in any one of these areas. Okay, the college also recognises prior learning when you're coming into the programme. So if you're not entering the programme until PGY3 or later, but also through your PGY2 time as well, is actually recognising that hospital experience. As I said before, paediatrics, anaesthetics and obstetrics rotations can count towards your training. So you can see we look at currency of experience as well. So some of the key resources for fellowship, encouraging you to have a look at our curriculum, the handbook for assessment and training. There's a lot there, but certainly if you're interested, browse on the website and all of that information is actually available to you to have a look at. Okay, now that's fellowship, that's the programme itself. And how do you get there? Okay, there's some training pathways. You may not be able to see all of this, but there are ways in which you can achieve fellowship. One of them is with the college directly through the independent pathway. The other one, which you may be familiar with, is the Australian Generalist Training Pathway, which is a fully funded programme through the Department of Health, so Commonwealth supported, and that's actually facilitated, supported and managed by the regional training organisations. There is also another pathway, RVTS, which is the Remote Vocational Training Scheme, which is very much focused on remote practice. And there's particular criteria to actually enter that particular programme. Okay, application process. So a little bit about our application. First of all, eligibility. So knowing what the eligibility is, its eligibility is slightly different for both AGPT, which is the Australian General Practice Training Programme, or Independent Pathway, IP. Both of them, we look at the citizenship status, your medical qualifications and your medical registration. The thing with medical registration is on the Independent Pathway, we do look at provisional and limited registration. But on AGPT, you must have general registration when you commence the programme. So if you're coming to the end of your internship and you're looking at your general registration and going into PGY2, you must have your general registration on commencement of training through AGPT. Okay, so the application process is a 4-step process. It's an online application. There's a suitability assessment, which is a written assessment. We look for referee reports, and then to top it all off, we do mini interviews, and we usually do that via Zoom now. So it's an easy process to go through. Everybody's familiar with Zoom, so it's you can stay in your location and actually go through your interview process that way. The criteria that we look for through selection is very based on your commitment to rural practice, your desire to work in a rural location, what is your connection with your community. These are the things that we truly look for. It's very much around rural intent and rural practice and your connection to the community. And I know that comes in many different shapes and forms, and it doesn't mean to say that you have to be working in a rural community, but it is very much about you demonstrating your commitment to that. I'll not talk through this, but you can see the different areas that we actually look for when we're doing the interviews and looking through the selection criteria. Okay, becoming a member, if you're interested in ACRRM, I would strongly encourage you as students to actually come through and as a student member of the college. It's relatively cheap. I think it's only about $40-something. It's not an expensive process, but it actually gives you access to a whole raft of information and also online programs, including the logbook as well, so you can get more familiar with ACRRM. And it also connects you to the ACRRM community, to wonderful people like Dr. Sarah Goddard and Dr. Lisa Walters, who'll be talking to you a little bit later, so you can explore a little bit more what it's like to be a rural generalist. Okay, some of the benefits are listed here as for being a member, but like I say, being connected to the ACRRM community is one of the biggest benefits of being a member of the college. The end. Thank you very much for listening, and I'll pass back over to Josephine.
All right, thank you very much. We now have Dr. Sarah Goddard, who will give us a presentation.
Thanks, Josephine. Let me just get it. Okay. All right, so I'm Sarah Goddard, also a fellow of ACRRM, an Aboriginal fellow of ACRRM. I also would like to acknowledge elders past, present and emerging from all the different locations that people may be watching this from, but particular today, as Josephine's already mentioned, the Larrakia people. So who am I? A lot of people tend to know who I am already because I've been a bit of a poster girl, but first and foremost, I'm a proud Kadage woman from Tennant Creek in the Northern Territory. I'm a wife, so I have an amazing husband who's supported me through all my training. I'm a daughter, a sister, auntie, cousin, the list goes on. From a medical student perspective, I've been a student, I've been a tutor throughout my career. I've helped a lot of colleagues, friends, and I've been a support person for anyone, not just doctors or students. In my town, in Tennant Creek, so my community, I am a community member. And for the last 4 years, I have been the doctor. I did my training in Tennant Creek and fellowed at the end of last year. So briefly, the starter fellowship. So I've always wanted to be a doctor. I always said I was going to do ACRRM and that I was going to return home to Tennant Creek. And here we are, many, many moons later, I've done it and I'm there. So I went to school in Tennant Creek, rural and remote, a bit of boarding school, did my medical degree at Newcastle in New South Wales. Was lucky enough to get an internship in Royal Darwin with the first lot of NT-MP graduates. And completed my resident year as well. And then I was successful in getting onto the AGPT under NT-GPE training to do my GP training. I did all my training in Tennant Creek, so obviously I did my internship and residency at Darwin, which completed the core clinical requirements from paediatrics, ONG. I later had to do my anaesthetics term through a ProStart program, which is accredited by ACRRM, the little nitty-gritty things you'll learn to know about. to get those qualifications to complete your core clinical training. I was lucky enough to do my AST in emergency, and I did that in combination with support from ACRRM and ACRRM at Tennant Creek, where I had one-on-one training time with FACEMs and supported. I did all my exams by Zoom, which is the new and updated way of doing post-COVID life, I guess. And yeah, got to fellowship in December last year. So I guess from my perspective, being a GP in my community, it's hard, but it's so rewarding. So everyone knows who I am. It was a bit of a transition period when I went home. I had to work out, was I the Aboriginal liaison officer? Was I an interpreter for some people? Was I a social worker? Was I the tour guide for my colleagues who'd never even been to Tennant Creek and decided to take posts there? Was I a med student support person? I was doing nursing jobs, not just medical jobs. And then obviously I was the doctor. Rewarding things, so calling people out of the waiting room and seeing their faces light up that it's me, their local girls now come back as a doctor. I guess challenges, it is a small town, it's very remote, everyone knows who you are, so going to a supermarket can be challenging, and learning that work-life balance, a part of ACRRM and remoteness, is a learning curve. I guess I always have to watch what I'm doing and where I'm at in my career and my life, because I want to be a role model for the younger generations to come through. I am the first Indigenous graduate in the Northern Territory for ACRRM, and I'm the second female graduate to get to fellowship as an Indigenous person, my preceding being Sarah McCure. There's many to follow, please. Working in the NT though it's that real life experience. So from a med student, I did a lot of my placements back home. Being biased, I have a passion and wanted to come back. But looking back now, the exposure, the health, the medicine, the diseases, the people you work with, it is ACRRM. So it's real life medicine. It's stuff that most of your colleagues or people that you went to school with or grown up with would never even think about being exposed to or knowing about. It's the real life curriculum of ACRRM that you go through as working as a generalist. Historically, it's been programs through Queensland, but we're breaching out now and we're in the NT, and looking back, you've got Indigenous health, but you've got rural and remote medicine. You've got a lot of multicultural distributions now. There's just so much, and we're lucky enough in the NT to have that. So come join us for sure. To get there though, like I said, you have to have your regional training organisation. Sandra's already mentioned signing up through ACRRM. Do it early. I actually was one of the fortunate ones. I knew what I was doing, but I signed up in my final year of med school or second final year, and I got my procedure logbook done well before a lot of my colleagues, because I'd already had that mind frame and I started ticking off. So when it got to pre-fellowship, I've got people running around trying to do courses and get extra time with surgeons, and it's easy to do if you want to do it. So put it in the back of your mind now, sign up to ACRRM, start your logbook, and always reach out to other people. Being an Indigenous fellow and any other Indigenous people, there's other supports around. So you do have your ATO and your ACRRM, but there's an Indigenous GP Registrar Network. There's AIDA, the Australian Indigenous Doctors Association. There's coming up in the world now, there's so many Indigenous doctors. So there's a lot of us out there willing to support and mentor and help. And I guess just FACRRMs in general. So they all have the passion for rural life. They live it, they love it, they do it day in, day out. So they're approachable. We're all human and they're willing to help. Throughout your different training organisations as a university, you have pastoral care workers, always making sure that you have your own GP, and trying to spend as much work-life balance and family and friends that you can do. Small towns, isolation, you need someone to talk to, so look me up. I'm happy. I respond to most people. I'm happy to give career advice. Most of you will probably come through. I'm a bit biased now, but if you want to, come to Tennant Creek. It's a good training ground. Been there, done that, and your exposure you get to do come along. And take the opportunities. So now in your senior, well, pre-intern years, get out there, do conferences, go to symposiums, look at courses, things like REST, or that in your junior years, or emergency training courses that can set you up so you feel that you've got the skill and support when you go out into these remote areas. Because at the end of the day, you go from being the person saying that go to your GP, the next day you are that GP. So it's a whole maneuver of changing around. Yeah, and I guess my inspirational person's my mum. So I'm where I am today because of her. So thank you.
Thank you, Sarah. We'll just move on to Lisa, and then I'll ask some questions so that people can get some answers.
Hi everyone. It's a hard act to follow Sarah. She's a pretty inspirational woman and she's done an incredible journey. So, but she's one of those people that I admire and think of as a role model. And although I haven't had to reach out because I've had a different base, I know that she's someone that if I said, hey, what do you think, she wouldn't hesitate to help. So I've just got some cute pictures because I just like to waffle. I'd like to pay my respects to the Larrakia people on whose land I am currently sitting and on whose land I live. But I'm very, very privileged at the moment that I work out in Maningrida, and I work in Malala, which has just recently transitioned from being a top-end health service organisation to an Aboriginal controlled health service. So truly amazing time and opportunity to be located out there in that amazing country. So I'm just going to flick through pictures and they'll probably end up just repeating, but I just wanted to talk to you a bit about my journey. I started as I was an emergency nurse and I was a remote area nurse, and I knew I wanted to join ACRRRM before I knew whether or not I got a high enough GAMSAT score to get into medicine. So I knew where I was going, whether I just didn't know if I was going to make medicine or not. So and the reasons behind that were multifactorial, but it was about that commitment to being someone who was truly there for rural and remote Australia and who supported the people that were there whilst that experience, who supported you to work in those experiences and who supported you to have options where you could access those sorts of courses, facilities, and have a skill set that was safe to allow you to be out there, because I think rural and remote Australians, Indigenous, non-Indigenous, deserve the utter best of the best of all client practitioners. If you are, you should be the A-grade doctor out there. You know, that attitude sometimes that we have to challenge about the attitude behind GP skills and things like that. You try going to a community where you are not only the GP, but you're also going from life to death and emergencies and birth and palliative care and child health checks and all of the bits and pieces that go between. So my love for ACRRRM comes from the college's acknowledgement that being in a rural and remote location is very, very variable and has a lot more to it than practicing in a mainstream general practice. So that was my driving force. I, like Sarah too, also completed my advanced skill in emergency. So we're both a bit sort of biased and we've both done the same advanced skill, but there's some fantastic options for advanced skills: palliative care, rural and remote medicine, Aboriginal and Torres Strait Islander health. So there's so many different options that you can really play to whatever it is that you and your community want. Some people don't know where their final community will be, and that's okay. You don't have to. I'm not sure that I know yet either. But, you know, it means that you have that opportunity that you can work out what's going to work best to complement your skill set to work where you're choosing to work. The other privilege of working in rural and remote locations is you get to work with some absolutely incredible people, and you get to experience parts of Australia that some people will never ever have the privilege of stepping foot onto. You get to be part of a community, and as Sarah said, sometimes that has its challenges, especially for someone who's lived in that community. And it also has its challenges when you're a visitor to that community. So, for example, I'm on a 6-month placement, so I am trying to make the most of being out in Maningrida, but I'm also very conscious of the fact that I'm a visitor to that community and how I fit into that. Fortunately, Maningrida is very proactive with some amazing experiences of, this is a weaving class held by the Women's Centre. This is a picture of us going out to get pandanus to do the weaving. That is my little attempt at a weaving basket, which you can see looks nothing like the amazing piece of art that's on the wall behind us where we're practicing. But hey, it was fun, and it's a privilege to actually be able to have other people teach you things and to go out to a community and listen and learn from an incredible culture. And that's me trying to peel pandanus it's exceptionally hard to do, and in the end it was taken off me because I was wasting too much pandanus trying to get it right. But the skills were incredible, and we just, there were just, how many times do you get to go and do that on a day off? Like, you just, and hear stories about people's health and their families and their lives and their dreams. So I think it's an amazingly privileged place to be. Yet works with some fantastic people. So this is just a group of nurses who kindly enough said, yes, I could throw their faces up on my presentation. But remote area, and I tend to talk more about remote because that tends to be more of my focus than rural, but, remote area nurses are quite incredible individuals, quite oomphy individuals, often with amazing personalities, but absolute pleasure to work with. So this was the opening day of Malala transitioning across. So lots of celebration and lots of happiness, and just an amazing team, because ultimately, your team in your community might be a whole of 2 health practitioners, or it might be a whole of 30 health practitioners, but you get to work within smaller teams, which means you get to usually have slightly more meaningful relationships than maybe you have in the hospital system, where you're a smaller, there's a much larger number and you're a bit more of a smaller fish to fry. So this is our new health centre now as we transitioned across, and fantastic pool. So I think one of the attractions of going out to these places, going out remote is that opportunity to go and to learn and experience different things. You get some interesting visitors. So that was a random cow whose name also happens to be Lisa, who was just double checking there was nothing funky in my bin out one morning. That's a pig whose name I have no idea of, but I woke up and he was out the front one day, and this is one of the baby buffaloes that just chases people around town. So it's not every day that you're talking to, say, your family on FaceTime and you're like, oh, hold on, there's a cow. Just wait, I want to show you this amazing cow that I've just seen. So you do get to see some amazing parts of the country and have some different experiences. Your advanced skills really, really important. And as I said, I did mine in emergency as well. What I love about ACRRM and NTGPE is the flexibility that both organisations have in their approach to helping people to get their journeys in the way that they get their journeys. And they're very good at acknowledging that we don't all follow the same steps and we're not all at the same place in time. And sometimes some people need something slightly more than other people, or they need to do things a little bit differently. And the college is flexible about that. You can do your AST first, you can do your AST last, you can shake up how you do it. So I think that that's a really unique thing. So I think ACRRM itself is amazing, but just a plug for NTGPE as well as one of the AGPT organisations. They are absolutely incredible in the support that they provide their registrars. So it's a good way to do it. The RVTS training skills tends to need to be someone who's maybe been out in a community for a couple of years and then is coming across. If you're interested and you're interested now at that sort of, or that's where you think you're going, then the sort of normal and probably the easiest, most likely supportive process is to do the AGPT process, unless you've been out for a bit longer, because remote vocational training schemes have a slightly different focus. So they're all things that you learn as you go along the way and you get some information from people. The joy about the territory, you can have the red dust and the ranges and the desert under your feet and the cold nights and the bonfires if you so desire. That's actually, this is cheating because that's actually just on the border of South Australia. But that was when I was privileged enough to be doing John Flynn when I was a Northern Territory graduate, Northern Territory medical student as well. Or you can be sitting at Nullumboy at the sailing club watching the sunset with those sorts of views. So, you know, the Northern Territory has absolutely everything that you could want and everything in between. And you get to practice in a slightly different way. So sometimes you get to have that bit more flexibility and fun with setting up for, this was for a paediatric clinic out in an AMS, and getting to have that little bit more fun with the way you practice medicine, and time and process is different. So you're often not on 15-minute appointments. You often don't necessarily know what's going to walk in your door. You often have, you know, you can have the greatest of days and expectations planned, but you might not end up actually getting any of that done because something completely different happens. So I suppose what I'd really like to just sort of highlight is Sarah made some really, really good points about training. So if this is something that you're interested in, there are some really easy ways to prepare yourself well. As Sarah said, getting that logbook printed out is a great way. The fellowship, and as Sandra has talked about the fellowship guideline and things like that, what I did is quite clearly made up a program list of, this is what I needed to complete AST, this is what I needed to complete core generalist training, this is what I needed to complete the rest of you know, primary training, and what I needed to do, and then you can work around it. And I think that's a really important process. NTGPU used to not have a lot of ACRRM graduates. Now we are overflowing with ACRRM graduates. So they, as a support provider, have realised that they can't just have an RACGP focus. They've really had to step up around having far more ACRRM involvement and ACRRM content to their courses. So that's worked really, really well as well. So as someone who's an active member within that training program, you know, you've got the different requirements that you have to do, but ultimately, as I said, ACRRM's just, it fits beautifully with me, my life, my career, where I want to be. And just like Sarah, I'm very, very happy to share sort of the way I approach training, the things that I did, and what works or doesn't work for people. So I'm happy to stop talking if we have questions. Otherwise, I can talk about the assessments forever.
So I just have a question for you and Sarah. So obviously Sarah has come from a remote setting and has grown up in Turnip Creek, so that was her drive to come back. But what would you say to participants or people who have never been to a rural or remote area in terms of how they can experience those things and things that they can try to get that kind of drive and that experience?
I guess from placement setting first, like wanting to take that leap. If it's something that you're interested in, put yourself out there and get those placements that, or compete to get those placements. There's the John Flynn, but any of your uni placements where you might have electives, some of your colleagues might be wanting to go overseas and these exotic, well, maybe not now, but previously it would have been everyone going overseas and going to all these exotic places. Look in your back door. Like, there's so many different locations around there to give you the skills that you need, or the experience. Just, if you're going on a holiday, look at these towns when you go there and think, you know, driving all through Queensland or something, or driving just from Darwin to Alice Springs. Think of these people on the side of the road who have nothing around them and how you can help or what you could do. Putting yourself in that situation. I guess having the supports before you go there as well, like emailing one of us, meeting one of us, the local doctor in the town, or the local council, or you're interested, you want to come, making them connections before you get out there. So then when you get there, you got a name to a face and you got people supporting and looking out for you when you go on these placements. I don't think there's anything you can do until you take the leap. You need to, if you want to do it, make it happen.
And do you think ACRRRM Connect is a good way for people who are a little bit unsure for them to get in contact with kind of experienced people like you guys?
Yeah, just put the email out there straight away. I don't know, from most NT doctors are all on a generic system or got some way of emailing them if you know someone's in a certain location. But ACRRRM Connect, I guess, would be your first starting point. Info at ACRRRM. Surely they've got a bank that can link you up with any of the FACRRMs around that area.
Yeah, Sarah, I'll just leverage off that. Yes, we do. Email inquiry@ACRRRM, anything that we get through. Our first thing is to connect them with the right people who can give them the right answers.
And I just think to back that up, one of the things we're very lucky about if being in the Northern Territory is actually we have quite a small, you know, although we're a huge geographical space, we are a small area. So someone's just decided to call in the middle of the meeting. But yeah, so as Sarah said, we are actually, you know, quite approachable. So, you know, if you are in your anaesthetics term, speak to some of the general GPs who are anaesthetists who are there doing their training. If you are if you are out on your GP rotations, if you can get those rotations from uni, absolutely. The National Rural Health Student Network is another organisation that you can get yourself involved with. So it sort of, you know, helps look at, you know, expose you to those sorts of things. It's a good, they used to have conferences. So there's those sorts of options of how you can look at getting out there. I grew up in the Blue Mountains, which wasn't remote, but I'm a little bit older, so maybe it felt a bit more remote when I was growing up out there, and was then working in, you know, a tertiary emergency department until I just took the step and took a remote contract in the middle of Western Australia, halfway between Alice Springs and Kalgoorlie, and was bitten by that bug. And once you've been bitten by the remote bug, that's it, you're in, you love it.
Perfect. Thank you, guys. Do you guys have any kind of last comments about the training or anything else that you want to share for the participants?
I guess I didn't mention it in my talk. Sorry, Sandra. Don't let knockback stop you. So I've had a really, really long journey. Getting over challenges of failing through courses in med school and then internship getting through and then even through the college. The support's there and the help's there. Just don't give up. If you want to do it, have a go, get the experience and just keep going. Persistence pays off. Like literally, look at me. I'm here. I'm doing it. I'm living proof.
I just want to put it out there. If you're remotely interested, didn't mean that to be a pun, remotely, rurally, anything interested, if you've got an inquiry and you just want to explore this as an option, get in touch with the college, get in touch with Sarah or Lisa, just to explore what that might look like for you. Don't roll it out as being too hard. I think, you know, listen to what Sarah had to say, listen to Lisa's story. And if there's something that's nagging you, I really want to try this, I would say give it a go. Give it a try a rural placement. And as Lisa said, you'll get bitten by the bug and really have a truly fulfilling experience. I'm not a doctor, but I work with a lot of FACRRRM, and what they give to community and what they get back is twice as much as what they give. So I would really encourage anybody who's, like I say, remotely interested, please get in touch and we can see if we can find a way to get that bug to bite.
The other thing that I would say from personal experience, having worked in some rural and remote places as well, is just to urge participants to try different places. You may not like the first placement that you go. Sometimes it's just that place, but I would always urge you to try another different place, because sometimes you find a different community kind of gives you that feeling of wanting to be in that type of community. So I think it's always good to give it another go, even if you're not sure it's for you, because you're not going to really know until you've tried a few different experiences.
And I think on a final note, or doesn't have to be the final note, but on a note, if you're quite training focused, which I know medical students tend to be in that stage of like just wanting to know, well, what do I literally what do I have to do? What do I have to do? And you haven't quite wrapped your head around some of the fellowship books or the assessment guidelines or anything like that. I'm lisa.waters@nt.gov.au. It's not hard. It's just water, like a glass with an S on the end of it. And you know, I can actually share some of the learning plans that I developed up for me. They just highlight the prerequisites in a way that makes it simple, and they've been updated because the course and the curriculum have been updated as well, so they are currently up to date. It doesn't mean that they'll work for you, but it might give you that nice sort of insight of, okay, these are the sorts of things I need to do. And if you've got an interest in emergency as your advanced skill, then definitely talk to Sarah or myself, because you know, it's about playing smart and getting the things done that you need to get done, and remembering that there are workarounds. So if you don't get that anaesthetic term, which is unfortunately in Darwin a difficult term for us to get, it is one of our roadblock terms up here, the college has options. It always has options. So it has ProStart as an option. If for some reason you didn't get an obstetric term, there are options for that. If you didn't get a full paediatric term, there are also options for that. So obviously we want people to have the terms and the experience, but you might have done paediatrics as an intern, not really felt you got a huge amount out of it because you're still trying to find your feet. You know, there are other suggestions about how to maximise that, such as doing, you know, further courses and things like that. So, and the joy of if you go rural and remote in the Northern Territory as a GP registrar is that there is quite significant financial subsidies to actually help with some of those massive costs that come with training and courses and all of those things that start happening once you've chosen where you're going and you need to get on that pathway. So if you work in an MM7 region at the moment, the Northern Territory General Practice Education, you're entitled to $10,000 of a bursary for 6 months in that location, which, you know, can really help take some of that financial burden off. So there are different bursaries and scholarships, so you just need to be all over what you might be able to get your hands on, so that make your life as easy as you can go through.
All right, thank you so much, guys. It sounds like you guys have answered most of the frequently asked questions, and I'm sure the participants can access the different resources. Training flow charts are on the FNT Rural Training Hub website, and this is the contact details for the Flinders Regional Training Hub. Central Australian Health Service and Top End Health Service have their training pathway brochures on there as well. And we thank you all for your attendance. And I also thank the panelists for turning up and talking about their experiences. So thank you so much to everybody.
Thank you very much, Josephine.